Today, we are here to share more about how Hawaii Pacific Health and HMSA will partner together to create a more connected, coordinated system of health and health care for Hawaii. This briefing is intended to explain what's being proposed, why it's being considered, and what happens next. We'll begin with brief opening remarks from each CEO. Rivera, President and CEO of Hawaii Pacific Health, will go first. He's going to outline the challenges facing Hawaii's healthcare system, why structural change is being explored, and what this proposal is designed to enable. Dr. Mark Mugishi, from CEO of HMSA, will then speak about what this means for affordability, for access, for provider experience, and the path forward. Now, after their remarks, we'll do Q&A. We'll give you a chance to ask your questions. I do want you to know that we're not able to do one-on-one today, so if you do have a question, that would be the time to ask. And we'll try to get to every one of you who have a question. At the end, both CEOs will then offer brief closing remarks. But with that, I'll turn it over to Ray Vera. Ray?
Thanks so much, Dan, and thank you all for being here. This is, in my opinion, as someone who's been working alongside Dr. Mugishi for a long time, this is an exciting day. But it really comes from the premise of something that we all know all too well, and that is that we've got a real affordability issue here in the state of Hawaii. Frankly, I would argue that it's the greatest challenge facing our state. You know, if you think about it, we've got thousands and thousands of people year over year that leave the state because they no longer can afford to live here. And we certainly know that for our young people, it's nearly impossible to ask them to come home and return to this place that we love so much. I have to share it. I'd be remiss, and I apologize if this drags it out a little bit, but it's very personal to me. Look, I've got 4 adult sons. I've got 2 daughters-in-law, and I got 2 3-year-old twin granddaughters. And I want nothing more than for them to be able to come home. And I can tell you they want to be able to come home. But the fact is that's a tall order to ask. And so when I think about the affordability issues here in Hawaii, it's something that I've spent my entire career working on and will continue to spend my time as I have an opportunity to make an impact. And even further, when I think about, look, I've chosen the profession of health. And when I think about healthcare in our state, well, it's not the single largest contributor to affordability in Hawaii. It's certainly in the top 3 to 4. And as someone who's an insider in the industry, I'm frankly quite concerned. I'm worried about its long-term sustainability. I look at it from a provider, a healthcare provider perspective. I've seen it from the outside looking in, as from the insurance perspective, and I certainly recognize it from a community perspective. And so after years of discussion and analysis and looking for alternatives and how to make structural change to create a more high-quality, affordable, accessible healthcare system for the state of Hawaii, Dr. Mugishi and I have come together, and what we're going to be doing is standing up in an organization that brings our 2 organizations together under a new parent, not-for-profit organization called One Health Hawaii, with the sole intent of creating an affordable, sustainable, high-quality, accessible healthcare system for the people of Hawaii. And so with that, I'm going to turn it over to Dr. Mugishi, or Dan, are you coming back up to introduce Dr. Mugishi?
So now, ladies and gentlemen, please welcome to the microphone Dr. Mark Mugishi. He's going to talk about what this means for families, for providers, and access.
Thanks, Dan and Ray. Aloha, everyone. Thank you for being here. Some of you see my commercials, so you know I've been in Hawaii all my life. I'm born and raised here. I love this place dearly. It's home to me. I've also been in healthcare my entire professional life. I started off as a physician, a surgeon, and then now I have the great privilege and honor to lead HMSA, which has a responsibility to take care of the healthcare of more than 750,000 people who live in this state. It is so important. 87 years ago, HMSA was founded by social workers who provided for a company with a mission to improve the lives of their members and the health of Hawaii. That's our mission all the way to today, and we take it very, very seriously. But Ray articulated really well, there's a lot of headwinds to achieving that mission right now. We struggle with affordability, we struggle with access, I don't know how many of you have had the experience of, I can't get an appointment with a primary care doctor. I can't get an appointment with a specialist. It's really, really hard. And then when I do, it's really expensive. And then I have to decide, like, do I want to spend my money on this or that? All of that is not ideal for taking care of someone's health and improving their life. So it is really, really time for structural change and to change them. Look, the world is replete with examples of companies that didn't change, right? Whether it's Blockbuster, Liberty House. There's a whole bunch of big companies in Hawaii that don't exist today because they didn't evolve. And yet there are other companies that have done great things evolving, whether it's Netflix or Amazon or Uber. They're all part of our life today because they evolved with what was needed to move us into a new direction of how we live our lives. And that's what we hope this will do for healthcare. And the reason for that is that an integrated entity under a common parent that believes in affordability and access will allow us the opportunity to bring a lot of fundamental changes to the way healthcare is delivered. And we're very, very, very excited to bring that to all of you in the state. And that will be part of the mission of both of our great organizations, and I'm really, really excited about all of that. I want to make it very clear that this proposed system is an open system. Every provider will join. In fact, we need them to join. Like at HMSA, we know we pay 1/3 of our dollars to Queens, 1/3 of our dollars to independent providers, and 1/3 of our dollars to Hawaii Pacific Health. There is no universe in the world where we can say, well, we'll just take 2/3 of them and not have them anymore. We need all of them. We need 100% of the providers to come along. We want our members to be able to see the doctor of their choice, to go to the facility of their choice, and so we will include everyone in this initiative that we're launching. So that is our great hope for all of this, that together, 2 local companies, locally owned, locally operated, will bring resiliency to the state of Hawaii. Thank you.
We're going to open it up for questions. If I could ask, when I put the microphone in front of you, if you would say your name, the media outlet that you're representing, and then ask your question. Who has a question? Just raise your hand. Anyone? Let's start back here.
Thank you. Hi, yes, Kimber Collins with KITV Island News. I was on the phone earlier today and I was told that this should not be classified as a merger. Why exactly is this not a merger, and what would you call this?
Thanks so much for the question. We would call it a partnership or an affiliation. It's really it's 2 local companies coming together under a new parent that will largely continue to operate each respectively the way they do with everybody else in the community on a going forward basis. The real opportunity comes through the efficiencies that we get through alignment between the 2 entities under the parent.
Name, please.
Daryl Huff from Hawaii News Now. A question for Mark Ruishi. From what I heard description, you guys are going to reduce the amount of pre-authorizations that you require of the Hawaii Pacific Health system by agreeing in advance to some sort of a care model. How do you bifurcate yourself in that way from the way you treat Hawaii Pacific Health and the way you treat, say, Queens or these independent physicians? Will you place this model of care on all physicians in Hawaii in order to really truly reach the efficiencies you want?
So the answer is yes, that model will be offered to everyone. Now there will be requirements for people to be able to participate, for example, sharing data, agreeing to the same outcome measures, and any provider who agrees to that, they are welcome. We want them. The more providers that are involved in this model of care, the more value will accrue to the people of Hawaii.
Okay, to follow up for clarification then, if I'm a doctor in Queens, and I will never be a doctor in Queens, I have a patient, I want to have a certain level of care for that patient. I have to follow your model of care in order to be reimbursed by you, or can I come up with an independent evaluation in order to be affiliated with you? And will I lose my affiliation with you if I don't follow that model of care?
The model of care will have a requirement that it has to be based on value, not just fee for service. So the days of a transactional relationship where you have a visit, you get paid this amount of money for that visit, we want that to be over. We want it to be outcome based, like you generate value for this patient for healthcare, then you will get paid. So as long as they're in that model, it's not going to be exactly the same. And in fact, the way that this organization is structured, there will have to be appropriate firewalls between the different contracting entities of the providers, but will all be based on value.
Any other questions? Sure.
Hi, Ashley Mazzillo with Hawaii Public Radio. Can you kind of just walk us through, so if you are with HMSA and maybe you have a doctor, a primary physician at Queens, what is the difference between that type of care versus someone who's with HPH under this new partnership?
There should be no difference. You still are allowed to go see your doctor, and you'll get the reimbursement the doctor will get will depend on the contract that they have with us. So again, like going back to this question of why is this not a merger, it's because there's a parent company that's deciding strategy and how we're going to try and create health. HMSA will continue to operate as a legal affiliate of that parent. HPH will continue to operate as a legal affiliate. So HMSA will have a contract with that Queens provider that will make sure that they are reimbursed.
Can you tell me, Joe Caraboto, KHON2 News, can you tell me who will approve this, or how is the approval process going to work, and when would this happen?
Great question. I'll probably just leave it at this. It's going to have to go through a number of state agencies to include a certificate of need process, which is overseen by SHPA, the State Health Planning Department. It's certainly, there's going to be conversations with the Attorney General. We've already had conversations with the governor. We'll have conversations with the insurance commissioner. And then there's also a federal approval that's going to be required, which will be determined once we apply for that approval, either be through the Department of Justice or the Federal Trade Commission, of which they will choose, and then we will follow that process. And timing, it's up to the process itself. On the short side, it could be 6 months. On the long side, it could be 18 months or longer.
Hi, I'm Stephanie Salmons with Aloha State Daily. Can you kind of walk through what the process will be for patients, for the community? Somebody looking to find a provider, find a healthcare. What changes for them? Can you walk through that process?
Today, the process is very fragmented. So we have some data about what providers are accepting new patients. Providers have some data about who's eligible to go see them and what their coverage is like. In an integrated entity, it's all shared in one database, one understanding, so the process should be much more seamless. All of the information, whatever customer representative you have to create the experience for the patient will have all of the information at their fingertips.
Oh, yes, another question here. I remember at the HMA forum, you mentioned that this is about trying to save money and affordability, and you touched on it a little bit that there is a doctor shortage. So even if this happens, people will still have to wait 6 months, 8 months to find a doctor. Do you see this alleviating any of that strain on the doctor shortage we have?
Absolutely. I mean, we've talked about there being savings generated through the combination like this, through the affiliation or partnership through One Health Hawaii. And that value is going to be significant. I referenced it before, and I feel comfortable saying it again, that it's going to be billions of dollars. And I know that sounds like a lot of money, but we're talking about over a long period of time. And so I know that sounds like a number that can almost be unbelievable, but I will tell you, when you look at the healthcare system across the state of Hawaii, there's a lot of opportunity to bring value to the people and begin to change the rate of increase in the cost of healthcare. And so when I think about where those investments into the communities will go, I really look at it in the three key investment areas. One is about lowering the rate of increase in the cost of healthcare. Okay, so making it on a going forward basis, on a relative basis, less expensive to afford healthcare. That's one. The second would be to reinvest in the healthcare community itself, making sure that we have physicians and qualified staff to care for the communities where there's the greatest need and where the most vulnerable exists. And then lastly, investing in upstream activity, what we refer to as the social determinants of health. Those things that truly create healthier communities. Things like investing in early childhood development, K through 12 education, affordable housing, workforce development, financial knowledge for families, those types of things that truly make an impact in terms of healthier communities. And when you bring all of those things together under the model that Dr. Mudiishi talked about, which again is not just for the newly created One Health Hawaii system, but it's also for every other provider and every other payer who agrees to commit to a healthier communities strategy. They'll be part of delivering that solution to our communities. And so I define success, if you were to ask me, is when an empty hospital bed is more valuable than an occupied hospital bed. That's how we know the things that we have done have not only made healthcare more affordable, but we've also made the impact of the health of the communities that we care so much about.
Anybody else? I want to make sure everyone has a chance. We don't have a whole lot of time left, so if you want to ask a question, now's the time. Anyone? Harold, I know you have.
Thank you. Both of you have described this as necessary for the survival of the companies. Can you tell me what would happen were you not to have agreed to this? And as a follow-up for Mark, how big a change is this for the overall operation of HMSA in this marketplace? Maybe that first, and then what would happen if you didn't pull this off?
So I'll start. I know this was one Ray's going to want to answer to, and I won't speak for him on what would happen to HPH. I will tell you that HMSA would do okay. We would do okay. But what the definition of that means is our company would still be here, and we would still be raising premiums at 10% a clip every year, like we're doing now, in order for us to stay in. What would suffer is the state of Hawaii. So we do not want to go out with that with our employers anymore. We want to be reasonable, like what we're charging for people. And so something like this is necessary for us to break that pattern. But this is a challenge that's not necessarily unique to Hawaii. It's happening to all health plans across the country. And the solution in most other places is consolidation of health plans. So big health plans will cannibalize the little ones. We do not want that in Hawaii. We do not want a for-profit, mainland, competitive, national to come here and take us. And so this is an attempt for us to say, we're going to be fine, we're going to survive, but the way we survive, we're going to survive by being local and taking care of the state of Hawaii. This is what we need to do in order to do that.
Daryl, you always know the questions to ask. You and I have been doing this for several years, having these kinds of dialogues, so I appreciate it. I want to reframe this. This is not about HMSA or Hawaii Pacific Health. This is about our community. This is about access. It's about affordability. It's about bringing all the resources from a healthcare perspective together in support of just that mission. The reality of it is we live in a small state with a finite amount of resources and have to manage those very effectively. Doing the same things we've been doing for decades, if not 100 years, is not going to produce a different outcome from where we stand now. And so what we're proposing is a solution that frankly has very little to do with Hawaii Pacific Health or HMSA and much more about the well-being of our community.
Thank you, Ray. Thank you, Doctor. Thank you for your questions. We will now go to one more question. Okay, sure. Ashley,
Last question.
this will be your last question.
During the HMA forum, you were talking a lot about duplicative administrative tasks that are being done and how this would kind of consolidate that. What does this mean for the administrative staff at HMSA or at HPH? Do you foresee like layoffs, or how is that going to work?
Yeah, great question. No, this is not about a reduction in the people who are providing care or the services. The fact is there will be a consolidation of administrative services, but like anything else, that takes time. Now, when you live in dynamic organizations like we live in, attrition will frankly allow us the opportunity to do that. So we do not envision any reduction in force or anything associated with these. We believe that we'll be able to garner all the economic value through attrition over time in a very coordinated, structured way. But since you opened the door, if I could, I'm going to tell you a story. When you think about duplicative efforts, frankly, certainly there's going to be administrative savings as we described at the corporate level, but the reality is, if you just think about what happens in the life of one patient who's in our hospital or any other hospital in the state, when they complete that course of care, what ends up happening is the next service needs get case managed. Whether it's medications, whether it's imaging, whether it's laboratory, whether it's rehab, all of those things get case managed on both sides. What if we lived in a world where not only does the health plan not have to do that, and we could do it just in partnership with the care provider? What you're essentially doing is you're taking the hard-earned premium dollar that people in this community pay for and getting it as close to the provision of care with the minimal amount of administration assigned to the cost of that care. And I will tell you, this is really one of the greatest challenges that face the healthcare system, across the country. Let's not forget, the entire country was shut down not so long ago, all on the basis of cost of healthcare in the United States. Okay, so let me share one quick story if I could. Sorry, Dan, I'm messing up with your timeline. But one quick story. Look, we own a children's hospital. We own Kapilani Medical Center for Women and Children. And we take care of kids who find themselves in harm's way with health conditions every single day. Unfortunately, we get to experience miracles where we nurse 2-pound babies to health and send them home with their families. So we get to see all sides of this. But one time, I was helping a family who, frankly, had a special needs child. That child had a device because they had a tracheotomy. And it was time to take that device out of the guidance of the caregiver, of the physician. And they requested that device, the physician requested the device from the medical equipment provider, and the device never came to the family. So what has to happen in order to change that out, you've got to downsize that device so the hole gets smaller. The risk of not doing that is that they have a risk for getting an infection, which would cost tens of thousands of dollars if that child gets an infection. Okay? But that device never came. And finally, when the family asked, they said, "Is this a money issue?" And when the device provider answered, they said, "Yes, but if you want to buy it, it's $80. And the family said, "Why didn't you tell me that after I've been waiting for weeks and weeks and weeks to get that device?" And eventually that child got their device, and I believe they likely prevented what would be potentially a catastrophic admission through an infection that would have cost the entire system of care, arguably our community, and arguably each one of us, because it attributes to the cost of health care. Okay? But it was safe because that family finally asked the right question to answer. They didn't know the scenario that was playing out. Now here's the irony of that situation. That child was my daughter. And I am as close to the healthcare system as you can get. And we fell victim to it. We didn't know what was going on. And it put our daughter at risk. And so if we can create a system that begins to eliminate that kind of risk and families to go through that, I promise you it's worth doing. So, thanks.
Thank you, Rick. You have all the time you want. Tell us an important story like that. Okay, we're going to have our final remarks. Dr. Mark Muishi will go first, followed by Ray Barrett.
So just wanted to share a little bit about what's next. So both of our boards, the HMSA board and the HPH board, have approved us moving forward. So what that means is, as Ray articulated, there's some processes that have to go now to state agencies and to federal agencies. So we will be submitting filings to both of those. Ray expressed a timeline that I think I agree with. So that'll be our next step. During this process, which is going to take a while, there are going to be a lot of questions because there's no denying this impacts a lot of different stakeholders: providers, patients, members, communities, employers, government. So we want to be transparent throughout this entire process and make sure all of you know what's going on. So we will commit to that transparency. We created a website, healthierhawaiitogether.com. Hopefully that's easy to remember. It's not great to spell, but it's up here, healthierhawaiitogether.com. And you can go there and we will have updates. We also have fantastic frequently asked questions with the answers depending on which stakeholder group you are. So if you're curious, what does this mean for me as a provider? There will be a set of questions and answers there for you. What does this mean for me as a patient? A set of questions and answers for you. So please encourage anyone who has questions or yourself to go to that website frequently and often and take a look. And finally, I just want to close with three very important points that I want to leave you with. The first is that this is 100% an open system. It has to be. We need all the providers, 100% of them, to come along with us on this journey to have the greatest impact for the state of Hawaii. The second thing I want to say is that this partnership addresses affordability, access, patient experience, and quality. And those are the things that all of us should want out of our healthcare system, which we don't have today necessarily. So hopefully that's what this will accomplish. And finally, again, these are two local companies, not-for-profit local companies, coming together for the sake of our community, not for the sake of ourselves.
Thanks, Ed. Thanks, Mark, for those comments. So again, I want to thank you all for making this a priority to be here and for hearing what we're embarking on. I have to tell you, as someone who's been working on this for years, I couldn't be more excited about what this represents for the future of our community. I know it can be scary. I know it represents a lot of change, but I couldn't be more excited because having worked on it for that many years, I know the impact that it's capable of making. And as you have already figured out, I suspect, it's quite personal to me. I know as a lifelong provider of healthcare services, it's important and personal for Dr. Mugiishi. And I'm going to be repetitive for sure and say, look, what we're bringing to this community in partnership with one another, but also through inviting all of the other providers and payers to be a part of this, is a high quality, accessible, open healthcare system that is certain to affect affordability, control cost, and eliminate, or probably factually true, certainly significantly lower the amount of administrative burden. So again, I want to thank you for being here and your time and attention to this, and I hope you're as excited as I am. Aloha.
Thank you, Mr. Barrett. Thank you, Doctor.